Good morning, all. I'm starting with my one more new lecture, that is Introduction to Community Dentistry. A group or population is not only recognized by their geographical area, but also by their interest and the common area they're sharing. What is community all about? A group of individuals and families living together in a defined geographic area, usually comprising a village, town, or city. A community is a social group determined by geographical boundaries and or common values and interests. So after community, let us know what is community dentistry. Community dentistry is that branch of dentistry which is practiced in relation to population and group, which derives from epidemiology and awareness of service required to organize the application of these services for the benefit of the population. Now, the science and art of preventing oral disease, promoting oral health, and improving the quality of life through the organized effort of society is here community dentistry. Now, if we discuss about development of community dentistry, there were several phases, different phases of development of community dentistry, how it was developed and in what way. In 1962, the Department of Community or Social Dentistry or Ecological Dentistry was set up in Michigan and Detroit. In 1963, it was developed in Alabama and Kentucky. Though there are various several services, those are rendered through provided through public health dentistry or the community dentistry. The health education in community, motivation of individual or community for receiving dental services. It is provided by public health dentistry. It delivers public health dentistry delivers dental treatment to the community through organized dental health camps, especially in rural areas where the facility is not available or is still out of reach, or they have hardly any dentist to treat them with their for their dental treatments, providing dental prophylaxis and other oral hygiene measures, including instructions in home care of the mouth. Through the school health programs, it provides dental care for school children. The application of caries preventive measures such as topical application of fluorides, PFS or patent pressure sealants, etc. Also, demonstration of new dental preventive methods and procedures to community. It provides dental treatments like extraction, oral prophylaxis, fluoride application, etc. through dental camps or through the school health programs. Conducting dental public health activities and field experiences for dental students and dental student nurses. So there are several areas of concern of community dentistry or the public health dentistry department. Area of concern foremost is history of dentistry, dental public health, epidemiology, biostatistics, healthcare provision, ethics and jurisprudence, practice management, behavioral science. After this, we have few tools of dental public health. It contains epidemiology, biostatistics, social sciences, principles of administration, preventive dentistry. So now we should know first of all what epidemiology is. Epi means among, and demos means people, logos means study. A Greek word that means study upon people, study upon people, upon people. The study of the distribution. Now, this is the definition I'm talking about. The study of distribution and determinants of the health related states or events in a specified population and the application of this study to the control of health problems. What is biostatistics? Biostatistics is a branch of statistics concerned with mathematical facts and data relating to biological events. And what is social sciences? Social sciences usually include sociology, cultural anthropology, and psychology. It is very useful in the understanding group behavior of a community. Now, there are few principles of administration. Dentist in leading role in public health programs needs to know the principles of administration by which large enterprises are administered. Administrative work is mainly through organization and management. It is not about only one person who can work or alone, but collectively through an organization and to managing it through various aids. Now, preventive dentistry, if you talk about this, it is in its broadest sense all of dentistry and encompasses those practices by the individuals and communities that affect oral health status. The levels of prevention are primary, secondary, tertiary, where primary may be known as health promotion and specific protection. Secondary is early diagnosis and prompt treatment. Tertiary level is disability limitation and rehabilitation. If you go for example of primary level, we tell people about mass about healthy practices, healthy lifestyles to keep a check on various diseases and to know how they can be healthy from a specific disease. Say if the brush people brush regularly, it can prevent plaque, plaque-related diseases, calculus-related diseases. Secondary level, early diagnosis and prompt treatment. If a disease is diagnosed by symptoms in early stages and given a prompt treatment, it can be prevented easily. Now, tertiary level, disability limitation and rehabilitation. If a person is disabled through absence of teeth in older age, you can provide denture and rehabilitation can be done so the person would be able to eat properly. Now, procedural steps in dental public health survey. This survey are methods of collection of data, analyzing and evaluating them in order to determine the amount of disease problems in a community and also to identify cases that have not been identified. Analysis information collected is subjected to analysis in order to define the characteristics of specific health problems in the community. Planning of a program planning. To design a program, it means the designing a program that is either comprehensive or cheaper and also accepted by the people and community. So program operation, the professional of various disciplines has to apply for execution, and the financing should identify the source of funds, usually through funds provided by the governments or by local or state authorities. Then comes the program appraisal. Effectiveness of the program is assessed. The dimensions used for the program appraisal are efficiency, appropriateness, adequacy, and possible side effects. So, what is the similarity between personal and community healthcare? Few similarities and also there are few differences. In personal means there is an individual patient you to take care of, and at community level there is a mass population you have to take care of. In patient you do individual examination, in community you have to do survey. Patient is diagnosed in person, and in community on the basis of survey and analysis is being performed. In personal healthcare, there is a treatment planning of an individual patient, and at level of community, there is a long program planning. Here again, in personal healthcare, treatment is being done of the patient after treatment planning, whereas in community there is a large program being operated. Large level of program is being operated. Here in patient pays for his personal health care and the payment of service being done by the patient himself. In community health care, there is a provision of finance. After personal health care of a patient being carried out, the evaluation is being done, whether it is good or bad, or what is the condition after the treatment done. And here at community level, there is appraisal. So, what are the objectives of community dentistry? It it has an objective to orient students to the profession of dentistry, its development and philosophies, and to the activities related to community oral health promotion, to develop in students the concept of ethical behavior as it relates to fellow students, the faculty, the profession, and society at large. It promotes the understanding of the laws, rules, and principles that govern the profession. It develops interpersonal relations, especially the dentist patient relation, including an appreciation for each patient as a person. It promotes the dentist's responsibility in helping to provide for the total health of the community and developed in him or her a concept of personal community awareness. It stimulates an interest in participating in the activities of professional societies and community organizations. Thank you.